So today I'm going to be talking about a new and innovative diagnostic tool called the Optomap. So what is the Optomap? The Optomap retinal exam is a digital imaging of the retina using laser technology. So basically it takes photos of the back of your eye. This replaces the traditional method of dilation, which is far more difficult to perform and has no digital records unlike the Optomap. It can capture up to 80%, which is around 200 degrees of the retina, whereas traditional methods can only see up to 15%, which is about 40 degrees. First, I'm going to briefly talk about the history of the Optomap. The Optomap was created in the early 2000s by Douglas Anderson after his 5-year-old son went blind in one eye due to a retinal detachment that was detected too late for treatment. Anderson wanted to create a new way to have a retinal exam done that is more comfortable and effective so that no other families would have the same problem as his did. Many of you may have used an Optomap before at your routine eye appointments, but for all of you that haven't, this is the quick and easy process. The optometric assistant will position your head and adjust the Optomap's height so that one eye is looking straight into the machine and you make sure that you're not blinking. Next, you will see a green line pass across the screen. You will then repeat the process once more or as many times until they get a clear image. So how does the Optomap work? The Optomap incorporates 3 low-powered laser wavelengths that scan simultaneously. This is the green line you see, which allows for a review of the retinal structures. The green laser scans from the sensory retina to the pigment epithelial layers. The red laser scans from the RPE to the choroid. The blue laser is used specifically for inflorescent angiography procedures. These images are then sent directly to your optometrist's computer. Now let's look at some images. This is an example of what an image may look like where the eye is healthy and completely normal. This type of ultra-wide field imaging provides a simultaneous view of the central, mid-periphery, and periphery. This also includes the optic nerve and many blood vessels. You now may be wondering why the retina is so important. Well, the retina is the only place in the body that blood vessels can be seen directly, so it can show early signs of disease not only in the eye but for other parts of the body too. Your retina is very important since it receives light through the lens in your eye and then produces a picture to send to the brain, enabling you to see. It is crucial to keep your retina healthy because otherwise the retina cannot send clear images to the brain, which result in unclear vision. What can the Optomap diagnose? The Optomap is able to diagnose eye disease such as glaucoma, macular degeneration, diabetic retinopathy, retinal melanomas, and peripheral abnormalities such as retinal tears, holes, and detachments. If detected early, most retinal conditions can be treated successfully. Therefore, it is facilitating early protection and preventing vision loss and blindness in the future. Not only can it detect eye disease, it can also detect early signs of strokes, cancer, cardiovascular disease, diabetes, and hypertension, which are all in other parts of the body but can be diagnosed before any other symptoms are shown. Are there any side effects to the Optomap? Nope. Optomap images are created by non-invasive, low-intensity scanning lasers, which means it's completely safe. The only thing you might experience is slightly blurry vision for a few seconds due to the bright light in the machines. How often should I have an Optomap scan done? Well, it depends based on your individual circumstances, but it is recommended to have one done every time you visit your optometrist for your routine checkup. This is around every 1 to 2 years. What age should I have my first Optomap scan done? It's the sooner the better. Many vision problems start at a young age, so it's important for everyone to get a scan done. Having these images done from when you're young also establishes a baseline for what your healthy eye looks like. Early detection is key to preventing eye disease, so it's important for everyone to have an Optomap scan done to receive the proper eye care they need. Hopefully you learned a lot more about the Optomap, and the next time you go to the eye doctor, you'll have an Optomap retinal exam done. Thanks for listening.